Good morning, everyone. I'm so excited to be with you today to share with you some training on how to support your clients with health issues. Now, the majority of people who are overweight or obese might have a variety of health issues. And as a health coach, it's important to know and understand some of the major diseases and the medications you might encounter when you're working with your clients. And it's important to document your client's medications on the client tracking sheet for a couple of reasons. When a question arises about your client and the program, you might want to get in on the nurse support call or else nutrition support, and you'll have that information available to assist in coming up with an answer. Because sometimes the nurses will say, well, are they on many medications? And you'll say yes, and they'll ask what they're on. So they're going to want to know that. Also, it allows you to track their progress towards optimal health, and to, because what's going to happen is you're going to be watching their dosages decrease and their medications get eliminated. So that's kind of cool. Whoops, sorry about that. Now, I didn't introduce myself. So for those of you who don't know me personally, my name is Jami Krietzman. I'm a registered nurse and a certified legal health coach. Certified health coach with Take Shape for Life. Hello. I'm sorry about that. I've been with the company going on 5 years, and they've all been terrific, and they've been fun-filled and action-packed. I mean, it's a great career. Now, for several years, I assisted Lori Anderson in hosting and presenting the National Nurse Support Call, and I've taken a bit of a hiatus from that to focus on training up health coaches and setting them up for success. And I've been really blessed to be able to work with hundreds of great clients and watch as they've turned their lives around. And it's really rewarding. I have to say, I have an incredible passion for this. Now, I'm equally as blessed to be assisting other health coaches in building their businesses and reaching out to the many people who are out there who needs our assistance and what we have to offer. Now, if you do not have the handout that I sent out, please shoot me an email and I'll send it to you after the training. You'll be able to get along fine without it. Do have a pen or pencil and paper available to take notes if you want to jot down, things or to ask, questions. Get your coffee and your tea or whatever beverage you're going to need, and a Medifast meal if you think you're going to be due for one, and let's get down to business. Okay, so I want to talk to you a little bit about what a health professional is. A health professional is an individual who helps or who works to help maintain or improve the health of their patients or clients. Okay? They're an individual who uses knowledge to promote wellness. Let's look at that again. An individual whose work helps to maintain or improve the health of their patients or clients, and an individual who uses knowledge to promote wellness. Wow, that's us. Guess what? We are the new health professionals. Pretty cool, huh? Didn't know you were a health professional, did you? Well, you are. Now, let me tell you what a licensed health professional is. A licensed health professional is any medical team member involved in a person's care who's licensed and authorized by the state to provide health care services consistent with state law. It's an individual who is licensed to care for sick people. It is a person who is licensed to give advice. So, are we licensed healthcare professionals? No, I am, but you guys aren't. Well, some of you aren't. So, do we give advice? Do we give medical advice? No, we don't. Okay? Now, what does a licensed healthcare professional look like? There you go. We have nurses, doctors, nurses and doctors, and a doctor. Okay, so I want to kind of switch gears a little bit and talk about certification. Certification is really important, and I really would emphasize this with all of you, and I would like you to get certified if you are not already certified. I see that there's several of you on the call who are, so I get to tell you more about why it's good that you got certified. So certification not only provides the tools and training required to deliver excellent support to every client, but it also establishes a credential and represents a level of excellence. And it helps to establish the benchmark of best practices that we abide by, and it enables a health coach to be consistent in the delivery of care that they're going to give their clients. Now, being certified means that you're serious about your profession, okay, and about helping people, and you're committed to a successful career path. And more knowledge makes you more competent and valuable as a health coach, okay? And clients are going to have the assurance that you have knowledge and skills to provide high quality support for them and their family members or their friends. So you can expect also increased recognition from your peers for taking that extra step in your professional development, and it builds confidence, and more confidence will help you grow your business, okay? And once you're certified, you are going to be cleared for a few things. You will be clear to approach physicians and chiropractors and other healthcare providers that you personally don't know. But you'll also be able to participate in trade shows and work with corporate wellness. So that's another cool thing about being certified. Another perk of it is that you can qualify to earn Medifast leads, which is nice. That's a nice benefit. So what does a certified health coach look like? Okay, there's Bonnie and Dave. They're certified health coaches. And Nancy and Jaime So, the importance of client profile. The client profile allows us to ask questions so we can ascertain whether there's any contraindications to doing the program. And the contraindications to doing the program you can see in your business blueprint, and you can also find it in the Office in Motion in the library. But some, contraindications are like heart attack within the past 3 months, or current or recurrent strokes, uncontrolled seizures, chest pain, things like that. So those are issues that if a client has them, as I said, it's a contraindication. But if they still persist and want to do the program, you tell them they need to follow up with their doctor and ask the doctor if it's okay. And if their doctor says it's okay, then they do it. Okay? Now, it also lets us see medications. Again, that's really important. Especially if you have questions about a client and their program and you want to get in on the nurse call or talk to a registered dietitian at nutrition support. Also, it's going to let you see the different herbs they might be taking and vitamins. And the cool thing is that our program, when they're on the 5-in-1 program, they are getting all the vitamins that they need. The only thing that I will have my clients take, me personally, is I will have them take a B complex, and I will have them take an omega-3 fatty acid which is a fish oil. Okay, you're going to find that there's some people that are taking handfuls of vitamins and herbs that they don't need to be taking. And some of the vitamins and herbs and different things are things they've seen at the health food store that it's going to help them lose weight or feel better or change their cortisol levels and all this other stuff. But they really, a lot of them don't work. It's just hype. Not the vitamins per se, but some of these like other weight loss means. So usually you can sit there and tell them that they really don't need to be taking some of these things that they're taking. The other thing is when they're taking a bunch of these herb supplements and vitamins that really aren't doing much of anything, they're also taking in extra carbs. So I know that I've taken and profiled a client that was on like 15 different things, and just the herbs and vitamins, not counting the medications. And I was able to tell her that she could be saving a lot of money just getting off of those. So that was kind of nice. You need to know what their activity level is, because they're either, not that they're only two things, but you're looking at, they could be a dust jockey, and so they're more sedentary, or they can be a construction worker. Okay, and be used to very physically hard labor. So that helps with us deciding how to personalize their program. The other thing is that we want them to consult with their primary care physician, so we just mention it, for them to do that, especially if they have health issues. Now, I love this cartoon. The top prescription is for your arthritis, but it might cause a heart attack. The second prescription should prevent a heart attack, but it could damage your liver. The third should prevent liver trouble, but it might destroy your spleen. And the fourth protects the spleen, but has been known to eat away the prostate. And the fifth, well, let me tell you, side effects are one of the things about medications. They all cause something. If you could look up any medication, you're going to see a slew of possible side effects. And the thing is, side effects do not usually cause you to feel good or wonderful. They always cause you to feel bad or rash or, whatever. But guess what? Our program has side effects also. But I like the side effects of our program. You're looking at no or very low hunger or cravings, increased energy, clear-headedness, increased mood, and an increased outlook on your life. And you can't beat that. Everyone needs what we have to offer. Okay, I'm going to switch gears here now. Okay, the skinny on visceral fat. Well, it's no secret that this fat resides all over. That fat itself, resides all over, not necessarily visceral fat. So in some places you're looking at your thighs, your underarms, your belly. It might be thicker than in others, but for the most part, it's everywhere, even on the soles of your feet. Okay? And a moderate amount of subcutaneous fat is essential for life. For one thing, it keeps you warm in the winter, but too much of it can be bad, starting with the fact that subcutaneous fat functions as a visible sign of being overweight or obese. And worse, it makes us lose confidence in our body image. And studies show that that leads to more dangerous behaviors. Okay? Now, visceral fat is more dangerous. Excess visceral fat can literally subtract years from your life. So let's look at the two different types of fat. Okay, we've got subcutaneous fat. Sub means beneath or underneath, and cutaneous means your skin. So it's fat underneath your skin, and it's the fat that you can see. It's the inch that you can pinch. Okay, now visceral fat, viscera means internal organs of the abdomen, okay? And what happens is it wraps itself around the heart, the liver, and other major organs. And it's referred to as hidden belly fat. And I want you to understand something. Thin people can still have too much visceral fat, okay? So just because someone is thin doesn't mean that they don't have it. So what does it look like? Here you go. That is visceral fat wrapped around an organ, and that organ, if you can see it in there, right there, is a kidney, okay? Here's another, what does it look like? Okay, here, this is a heart, and this is like the fat globules on the heart. This isn't good, okay? Again, fat globules on the heart. Now, this is livers, and this is a normal looking liver. This one here in the middle is a fatty liver, and this one here is a cirrhotic liver, or if someone has cirrhosis, sometimes you'll see livers like this with hepatitis. So the thing that I want you to understand is the proximity or the closeness of the visceral fat to your liver boosts the production of LDL cholesterol, which is the bad cholesterol. And that collects in your arteries and forms plaque, which is a waxy substance. And over time, this waxy plaque becomes inflamed, and it causes swelling that narrows the arteries, and it restricts the blood flow, or the passage of the blood flow. So the narrowing passageways increase blood pressure, and that strains the heart, and it can potentially damage all these little teeny blood vessels called capillaries. So the inflammation then further increases your risk of blood clots, which can then break loose and cause a stroke. So that's not too cool. So again, what does it look like? There you go. There you go. And the other thing is it's not just adults. It can be in children too. I like this picture. So now, metabolic syndrome or syndrome X. I just want you to know that having just one of these conditions contributes to your risk of serious disease, but your risk grows exponentially as the number of symptoms grow. Okay, so carrying excess visceral fat is one of that complex group, and the visceral fat has been linked to a long list of adverse health conditions, including high blood pressure, stroke, heart disease, high cholesterol, diabetes, breast cancer, dementia, and the list goes on. So, and other symptoms, like I said, high cholesterol, high blood pressure, and elevated insulin levels, which are not good. So ultimately, it leads to those things, which I've already discussed. I'm so sorry. I got ahead of myself. So this leads to diabetes, heart disease, and stroke. Okay, switching gears here. And I'm trying to, go as quick as possible so I can open it up for some questions at the end. So we're going into high blood pressure. Yay! So high blood pressure, also known as hypertension. Many people in the United States have high blood pressure. Unfortunately, this disease can do a lot of damage before someone knows that they have it because very few people have symptoms. So, blood pressure is the force of the blood against the walls of the artery. And it's typically measured or recorded as two numbers. There's the systolic, and as the heart beats, over the diastolic, and that's as the heart relaxes between beats. So what was I going to say? I'm sorry about that. Now, the diastolic number is the most important number for young people. But as people get older, the diastolic lowers and the systolic becomes more important. Okay? And this 110/70 is, if you look at textbooks, that's textbook perfect. So, not that that says too much, because 100/60 is good too. So, now, blood pressure rises and falls during the day. And when it stays high over time, it's called high blood pressure. And a consistent blood pressure of 140/90 or higher is considered high blood pressure. But if someone has diabetes, heart disease, or they've had a stroke, the blood pressure is considered high if it's over 130/80. But, you know, nowadays, what they're saying is if it's over 120/80, you know, we need to start monitoring. So I want you guys to think of a traffic signal, okay? So green for go, normal, under 120/80, and that is a good one. Pre-hypertension or pre-high blood pressure, you're looking at if it's under 140/90 but higher than that 120/80. And then hypertension or definite high blood pressure is 140/90. And in the handout that I sent you, it shows stages and stuff like that, and it goes into more detail. But I mean, if you can just keep your thoughts on that, that'll really help you out quite a bit. Now, uncontrolled high blood pressure causes damage to the blood vessels and hardening of the arteries. So what happens, you get a buildup of plaque and also a narrowing of the arteries. So here you see a nice, smooth, clean artery. It's open, so blood can go through there really nicely. Then here you see an artery with some damage. You've got some plaque buildup there, you've got some thickening, but if you sit there and you look at it, you know, like you're looking down a straw, it's kind of narrowed quite a bit, so that's not a good thing. And that's where you're looking at the higher blood pressures. So, the effects of high blood pressure on your body. You know, what's going to happen is it's going to cause you have the hardening of your arteries, which causes the heart and kidneys to work harder. So a blocked or ruptured blood vessel in your brain can lead to a stroke. And then high blood pressure also increases the risk of heart attack and congestive heart failure. So the thickening of the heart walls makes it really difficult to pump enough blood, and this causes the fluid to build up in your lungs or even back up into your legs and your feet. And that's where you'll see a lot of people with the swollen legs and feet, even hands sometimes. Weakened arteries or narrowed arteries in the kidneys can cause the kidneys to not work as well or remove waste products from the blood, and this in turn will raise your blood pressure. Okay, and then the thickened, narrowed, or torn blood vessels in the eyes can cause vision loss. So we have a lot of things that can happen just from high blood pressure. So some signs and symptoms. You know, it's called the silent killer because most people have no signs or symptoms. But, you know, there, as I said, usually no signs or symptoms of high blood pressure until it gets dangerously high. And then you're looking at nosebleeds, headaches, dizziness. So what's important is even you yourself check your blood pressure. You know, they have got them at pharmacies, and they have blood pressure cuffs at grocery stores, and they're free. You just stick your arm in there, and it's an automated cuff. So, but do have your clients, especially the ones who have high blood pressure, to monitor their blood pressures. So, who gets high blood pressure? Well, high blood pressure is common, but it's really common in African Americans who excuse me, many of them get it early in life and more often than white people. And African Americans are also more likely to die of a heart attack or stroke related to high blood pressure. And so people who are older, so the risk of high blood pressure increases as you get older. If you're overweight, so you don't have to be old, you can just be overweight and have a higher blood pressure. The other thing is if there's high blood pressure in the family, if there's a family history of it. So some of the things that can be done to help lower the blood pressure. We're looking at limiting the sodium and salt intake. So research shows that eating less sodium and salt lowers the blood pressure. Okay? Our program, if someone is on the 5-in-1 program, they most likely will be getting 1,500 to 2,400 milligrams of sodium a day if they follow our program. What was I going to say? I'm so sorry. The average American takes in about 7,500 milligrams of sodium a day. So that's where a lot of the high blood pressure is coming from. Also, you can lower your sodium intake by eating out less often. I was like floored when I sat there and looked at the nutritional information for like Outback and Olive Garden, because I do lean and greens there, and some of the lean and green meals are more sodium than I should be having in a day. So just from the one meal. So that's another consideration, eating out less often. Buying fresh, frozen, or unsalted canned vegetables. I always buy fresh or frozen, mostly fresh because I just like the way it tastes better. Choose foods with less than 400 milligrams per serving of sodium. And buying lower reduced sodium or no salt added foods is important. And use less salt. Let's get the salt shaker put away. So, being overweight increases a person's risk for developing high blood pressure and heart disease. Blood pressure rises as the body weight increases. So when you carry more body weight, you need more blood to supply nutrients to the various parts of your body, and so the volume of blood increases, and that causes extra force on the artery walls. So losing even 10 pounds can lower blood pressure. Okay? Now, being physically active is one of the most important steps you can take to prevent or control high blood pressure. Okay? And it doesn't take a lot of effort to become physically active. Walking for a total of 30 to 40 minutes each day can lower your blood pressure. And you can spread out the walking if it's too hard to do all at once. Try walking 10 to 15 minutes a day, 10 to 15 minutes several times a day. So the thing is that with your clients, well, first, heart muscles have to work harder with each contraction when you're overweight. Again, increases the force on the arteries. But, I have some large people and that are very sedate and or sedentary, and so what I do with them is once they hit their 3 weeks, I'll have them start getting up and walking around the kitchen or dining room table if they are like homebound. If they at work and things like that, I want them to get up out of their chairs and walk around their desk area or around their department just a little bit, just to get up and move, and then we progress it from there. But being active really helps. I love this cartoon. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? That's really cute. So, managing stress. So high levels of stress can temporarily cause dramatic increases in your blood pressure, okay? So the thing that you need to understand is that the effects of stress are usually only temporary on your blood pressure. But if you have stress regularly, it can produce increases in blood pressure that can damage the heart and the arteries and the brain and the kidneys and the eyes. So you can better cope with stress by making changes in normal routine and by developing relaxation techniques. So deep breathing exercises, muscle relaxation exercises, meditation, Tai Chi, yoga. These are all things that you can suggest to your clients who might be having some stress. But let them know that it can cause high blood pressure. Now, blood pressure medications. Doctors usually start your clients on blood pressure medications before having them try to make lifestyle changes. And this is where you're going to have to teach them to be observant about the way they feel and to monitor their blood pressures. There are many different types of medications that work in a variety of different ways, and your clients may be on one or more of them. So diuretics help your kidneys get rid of excess sodium and water, so it reduces the blood volume. And so some of the drugs that you might be hearing here are Lasix, furosemide, HCTZ, hydrochlorothiazide, or a slew of others. Okay, so usually those are one of the first medications that a doctor will get rid of when a person is on our program and they're doing well, because our program has almost a diuretic effect, which is good. So that's one less medication that they're taking. Now, beta blockers cause the heart to beat more slowly and less forcefully, so there's less pressure on the heart and the arteries. So some of the medications you might be hearing with this is like atenolol, metoprolol XL, metoprolol, things like that. Again, these medications are listed in your handout. ACE inhibitors help blood vessels relax, so you might hear things like lisinopril or Prinavil or Zestril. Calcium channel blockers also help relax muscles of blood vessels in a different way. And so you're looking at diltiazem or cardizem. You're going to, as I said, there's a list of examples in your handout, but new medications come out daily. So this list might change by tomorrow, but there's still some standard drugs that are used quite often and that you're going to get used to seeing. By no means do you need to memorize this. That's what this handout is for. You'll have it there if you need to see it. But when you're doing your client intake and you're filling out the client profile, ask your client what medications they're on. You don't need to know it. And then when they tell you the name of the medication, you sit there and go, and what do you take that for? Okay, that's how simple it is. Now, here's some health coach pearls for you. And I want you to remember, though, that making changes in a lifestyle can prevent and control high blood pressure. And that's what you need to emphasize to your client. Okay? So the first thing also to emphasize is follow up with their physician. Very important, especially if they're on medications. Healthy eating is important. So stress to them the importance of being on plan. Choosing and preparing foods with less salt and sodium. Okay? You need to stress losing weight if they're overweight. Also increasing their physical activity, and while they're on the program, have them check their blood pressure 2 to 3 times a week. Really important. Also, do not advise them on medication adjustment or discontinuation. Okay, that is the doctor's job. Remember, we're not licensed health professionals. So you can sit there and advise them to follow up with their doctor, but do not advise them on medication adjustment. Educate them on the signs and symptoms of low blood pressure. Extreme tiredness, weakness, drowsiness or lethargy, dizziness or lightheadedness, especially if they're standing up suddenly, fainting, feels like they have rubbery legs. Okay, so if you have a client who is on the program, you know, they went through their first week, they're feeling great energy, you know, doing really good, calls you up like in a week and a half or so, 2 weeks, maybe further down the line, and say to you, I am so tired and I feel so weak and I'm just tired. You know, first you're going to sit there and figure, okay, are they in the fat burning state? So you're going to ask them the appropriate questions like, you know, do you have any hunger or cravings? You know, stuff like that. If they don't have hunger and cravings, more than likely that they're still probably fat burning. But then you look and see, oh, she's on blood pressure medication. Then you say, when was the last time you checked your blood pressure? Because it might be low. And so that's really important. So that you can think, you know, I want you to keep in your mind that if no medication adjustments have been made, then there's a good chance that the blood pressure has stabilized, and so the person is taking blood pressure medication to lower a blood pressure that is already normal. So they need to call their doctors for those signs and symptoms because the doctor might want to adjust their medications. Now, if the blood pressure is low after talking with the doctor, they can have a cup of bouillon or a dill pickle and then drink some more water. You want them to drink a lot of water because that will also bring the blood pressure up. And remind them they're not going to increase their sodium intake to feed their blood pressure medication. You know, that's a big thing. A lot of people will sit there and eat to counteract the side effects of a medication or of medications that are at too high of a dose. So we don't want them to do that. Now, switching gears on you guys again, and we're going to talk about diabetes. So, type 1. It used to be known as juvenile onset or insulin-dependent diabetes, okay? And it's caused by no insulin being produced by the pancreas. And so an external or outside source of insulin must be administered to work with the sugars that are being eaten. So type 2 diabetes used to be known as adult onset or non-insulin dependent diabetes. Guess what? It's not for adults anymore. Young kids are getting this now, and it has to do with our lifestyle. So it's also insulin resistance, or it could be not enough, or your body is not responsive to the insulin that it's producing. And the reason it's not responsive is that insulin resistance, and it's the insulin resistance in the tissues. So we're looking at the insulin resistant fat. Okay? Now, it means that you have one or more problems with the insulin. As I said, your body might not be making as much insulin as it needs, or your insulin might not be working as well as it should be. So, normally, your body makes as much insulin as it needs. And this happens automatically for people who do not have diabetes. So let's look at how this works here. When you eat, your body digests the food and turns some of it into blood glucose, okay, or blood sugar. And the blood sugar is the fuel that provides energy for your body. Now, to be able to use the blood sugar for energy, your body needs insulin, okay? And so if you have type 2 diabetes, there's a problem with the insulin. So let's look at how it works. Insulin works with the cells of your body like a key works with a lock. So you have a bazillion cells in your body. So this picture really works quite well. I love this. It's a little cell and here's a little door. and the door is closed and it's locked, okay? But you can open that door if you have the right key. Now, insulin is the key that unlocks the door. And if the insulin key works in the lock, the door is going to open. But let me tell you, people have had keys and have tried to open doors or things and it doesn't work. Have you ever done that before? Have you ever used a key and it didn't work? Well, that can happen too. So when insulin unlocks the cell, glucose can move from the blood into the cell to provide energy. Now, when you have type 2 diabetes, you can have either of the next two, or both of the next two problems with the insulin. First one is your body makes the insulin, but the insulin doesn't work as well as it should. So your body is making the keys, but your keys don't work very well at opening the locked doors of the cells in your body. So some of the keys work and some of the keys don't work, okay? And when the keys and locks are not working well together, it's hard for that blood glucose to move from your blood into the cells of your body the way it's supposed to. So the second scenario is your body is making insulin but not as much as you need. So you are making the keys but you need more keys. There's not enough keys. So your insulin keys might be working really well at opening those locked doors of your cells, but your body doesn't make enough keys to open all the locks. So I want to talk a minute about high blood sugar, also known as hyperglycemia. Hyper is more, glucose, or glycemia is sugar in the blood. Okay, so too little insulin, too much food, or too little exercise. That's what causes it, okay? And it can occur at times of illnesses even if there is the right amount of insulin and food and exercise. So when diabetics are ill, even if they're doing everything that they're supposed to do, they might have a high blood sugar, okay? And it isn't anything that they're doing that's causing the blood sugar, it's the illness, it's the infection, it's the virus. And it's also stress. Stress can cause high blood sugars too. Now, some of the signs and symptoms you're looking at for a person with high blood sugar. Okay, frequent urination, extreme hunger, extreme fatigue, unusual thirst, irritability, blurred vision. Now, the other thing I want to talk about here, is exercise. So, exercise in the diabetic. So, a normal blood sugar ranges from person to person, but usually on average it's about 70 to 100. And again, in your handout it lists ranges for blood sugars and A1Cs and all that other good stuff. So, if a person's blood sugar level is elevated greater than 300, they should not be exercising, okay? Very important, because when blood sugars are high like that, the body will use the muscle rather than the carbs as its energy source. And when they're exercising with those high blood sugars, it'll cause muscle damage, and you don't want that. Now, let's talk about low blood sugar, or hypoglycemia. It's sometimes called insulin reaction, and it's when the blood sugar gets below the usual 70, okay, which is the bottom of normal. And so it can come on really quickly, and it can be caused by too much insulin, eating not enough calories, or too much activity or exercise. So what is going on is there's not enough sugar in the blood. And it can become an immediate medical emergency if it's not treated quickly. So here's some signs and symptoms. You're looking at hunger, shakiness, dizziness, sweatiness, fast heartbeat, drowsiness, feeling irritable or sad or angry, being nervous, they might be pale, feeling sleepy, lack of coordination, tingling or numbness of the tongue, personality changes, passing out and seizure are usually towards the end, towards the, that's when things are really bad. But one of the things, just like an interesting little tidbit, there's been several cases of diabetics being thrown in jail who have very low blood sugars because they present as a person who might be drunk. And one of the things, the signs that a person has when they have low blood sugar and even high blood sugar is they'll get this like fruity breath smell, which can be, make it smell like alcohol or beer or wine or something like that. So a lot of them have been thrown into jail, and so it's just very important just to monitor this. Have them monitor it. It's not your job, but it's theirs. Now, what to do? If your client calls you and tells you that their blood sugar is too low, you want them to check their blood sugar and let you know what it is. And if their blood sugar is between 60 and 70, have them eat a MetaFast meal. Okay, a bar, pretzels, cheese puffs, whatever. Because, and I say not orange juice, because usually a small glass of orange juice has about 12 grams of carbs in it, which is all fine and dandy. But a MetaFast meal has the carbs they need, but also the protein they need to keep the blood sugar up once it does come up. So I don't want them to have orange juice. That's kind of a moot thing at that point. So after 15 minutes, have them check their blood sugar again, okay, and see where it's at. The other thing is if their blood sugar is 60 or below, have them take in a source of fast-acting sugar. They might have glucose tabs, they might have glucose gel, cake gel, syrup or honey, anything like that to raise their blood sugar, up. And yes, they'll probably more than likely get out of the fat burning state, but that's not a concern at this point. We can always get them back into it. So that's really important. So some complications. Heart disease accounts for about 65% of deaths in people with diabetes. Okay, the risk for stroke is 2 to 4 times higher among people with diabetes, and 24,000 people with diabetes lose their vision each year. And I'm sure it's more than that. I haven't done any research lately to update that slide, so forgive me for that, but I'm sure it's much higher now. And diabetes is the leading cause of kidney failure. So I want to share with you something that happened just yesterday with me. I had a person call who I talked to probably about 8 months ago, who was a diabetic, had high blood pressure, just a whole bunch of issues. Well, anyways, her diabetes got so bad that she is now on dialysis. She's a young gal. She's 40 years old, and her kidneys are shot. And she's on the list, the donor list. She needs a kidney. So the thing is that her diabetes progressed so badly, and she didn't take care of herself, that she ruined her kidney. Or kidneys. So the thing is now that she called me because her physician wants her back on, he wants her on Take Shape for Life. So, she's calling me to support her, which is great. The thing that stinks is she's getting dialysis 3 times a week, and we'll be doing that for at least the next year until a kidney donor can be found. And when I sat there and I asked her, well, is there any of your family members that might be a good match for you? None of them could be used because they all have type 2 diabetes. Okay? So it's a familial thing. But it's type 2. So what you're also looking at is its habits, its lifestyle. It was how she was raised as well. So it can be a bad thing. Now the other thing is more than 60% of lower limb amputations occur in people with diabetes as well. So as a nurse, I used to go into a patient's room, and when we go into a room, we kind of do what's called a 60-second survey, is where we kind of look at them. Are they breathing? What their color is? You know, I'll sit there and look at the bed itself and how they're positioned in the bed, and if there is any things that are, you know, missing. So when I would go do an assessment, if I saw someone who was missing toes or feet or legs, I knew without even looking at their charts that more than likely they had diabetes. Okay, because diabetics, it's very hard for them to heal. It's a very slow process, especially if their blood sugars are not in control. So possible medications: insulin. And guess what, guys? Insulin causes a person to gain weight. Excuse me. Excuse me. Sorry for the sneeze. Glucophage or metformin. Metformin is the generic name. Glucotrol, Actos, Avandia, and I have Glucotrol again. I'm sorry, guys. I need to fix this. Of these medications, and there's certainly a lot more, of these medications, I guess the one that I'm least worried about is if someone is just on glucophage or metformin, because that drug does not work by lowering blood sugar. It works by making a person's tissues more receptive to insulin. So I know that they're not going to bottom out, most likely, from that drug. So people who are on that medication will be diabetics, but you might also see women and teens, young women, on it for polycystic ovarian syndrome. And that pretty much is a precursor to diabetes as well. So those are some of the drugs you'll see. Now here's some pearls for you. So if your client has type 1 diabetes, they can only use the products as nutritional snacks only. And they cannot go on the 5-in-1 plan unless they are under the direct guidance and supervision of their doctor. Okay, very important, because these people do not make insulin. They have to get it from outside of their body. A lot of these folks are on insulin pumps. So you're looking at a lot of medication adjustment that would have to be done if they're on the 5-in-1 program. And so the doctors need to really monitor their labs. So, but you can still support them and, you know, be an encourager and a guide and things like that. You just need the assistance of their physician. Now, type 2 diabetics can utilize either of the programs, the Medifast Plus for diabetics or the 5-in-1 plan. And the thing is that Medifast products were made for diabetics, okay? So it really doesn't matter which one, and because of all the different foods and everything that we have to offer, the only difference between the Medifast Plus for Diabetics program and the regular 5-in-1 is that the shakes have less sugar grams, and not that it's that much less. And so because most people don't, I mean, they'll have some shakes, but they don't have a lot of them, so it's not going to make that big of a difference. And I usually, most of my people, I mean, they'll do a variety pack, but they'll also do pick and choose. You know, they'll you know, design their own menus, so a lot of them don't do shakes. So, but they're still, their blood sugars are controlled, you know, by just being on the program. So what's going to happen is they're going to need to follow up with their doctors for routine lab work and medication adjustments. Okay, very important. So educate your client on the concept that they're not going to eat to feed their medication. Okay, Very important, especially on the people that the medication lowers their blood sugar. If their medication lowers their blood sugar and they start to feel, crummy, they're going to eat something, if their blood sugar goes low, because they know that if they eat something, they'll feel better. Well, we don't want them to eat to counteract the effects of their medications. We want them to talk to their doctors and have that medication adjusted. So now, Take Shape for Life recommends checking blood sugars at least 2 to 3 times a day, especially in the beginning of the program. Big, big, big here. Do not give medical advice. Remember, we are not licensed healthcare professionals. And do not adjust their medications. We are health professionals, the new health professionals, but we are not licensed. We might be certified, but we're not licensed. Okay, switching gears here again, guys. Okay, let's talk a little bit about cholesterol, also known as hyperlipidemia. Okay, cholesterol. I saw this picture and it reminded me of these hamburgers I had in California when I lived in California a long time ago, In-N-Out burgers, or there's Tommy burgers. And oh, they were so good. They were just dripping with fat, but they were so good. And if I eat a burger like that now, or even any burger like from a fast food place, we're talking Big Mac attack here. I get sick because my body is so not used to having that junk in it. So, what's cholesterol? Okay, well, cholesterol is a soft, fat-like, waxy substance, and it's found in your bloodstream. And it's used to form the cell membranes and some hormones, and also to make vitamin D. Okay, now it comes from 2 sources. Your body produces it in the liver, and that's mostly genetic. Okay, and then you're looking at food sources, which you're looking at animal products, meats, poultry, fish, eggs, butter, whole milk, and cheese. It's not found in plant sources though. Okay, now foods with trans fat or saturated fats can cause the body to produce more cholesterol as well. All right, and high levels in the blood are a major risk for coronary heart disease. Now, cholesterol needs to be transported through the blood, okay? And so the carriers of the cholesterol are called lipoproteins. And low-density lipoproteins are called LDL. So if you've ever seen, if you've had a cholesterol level done and it was a complete, profile, it will break down your cholesterol and your fats in your blood. So LDL is one of them. And then there's the HDL, which is your high-density lipoproteins. So those are big words, but let's break it down. Lipoprotein. Lipid and lipo is fat, and you know what protein is. So a lipoprotein is a protein that has a fat. Now LDL, which is your low density lipoprotein, has more fat and less protein. Okay? And an HDL has more protein and less fat. So the LDL is your bad cholesterol, okay? Too much of it can clog your arteries by forming plaque. And atherosclerosis, which is, plaquing in the arteries, can cause heart attacks and strokes. Okay. Now, here you see vessels. And here's a normal artery, again, and it's nice and clear. Here's a little bit of mild atherosclerosis, and so you see a little teeny bit of plaquing in there of the cholesterol. Here's a lot, severe. And when someone, is that blocked like that, that's when they're going to be experiencing maybe some chest pain. But again, you're looking at a person who is waiting to have a stroke or a heart attack. So that's how that works. Now, HDL is your good cholesterol, okay? And it tends to carry cholesterol away from the arteries and back to the liver. And it can also, as I said, remove excess cholesterol from the plaque in arteries, and it can slow the buildup of the plaque and the bad cholesterol. So, now, I have this in your handout. There is all the levels that you need to look at and you know, that you don't have to look at, but you have for reference. So total cholesterol, which is all the cholesterols all together, optimally, we want it under 200, really under 190, you know, because I've known of physicians who will put people on medications if they're between 190 and 200. So, that's where we want it. For an LDL, which is your bad cholesterol, we want it less than 100, okay? And again, you can see the other ones, you know, in your handout. It's in there, it's written out for you. Now, the HDL, which is your good cholesterol, your high-density lipoproteins, we don't want it to be low. We want it to be high. Kind of confusing, huh? So low is if it's less than 40. Again, we don't want it there. We want it above 60. And what happens then is it can lower the risk for heart disease. So again, it's good to be over 60. Now, women tend to have higher HDL levels, and it has to do with their estrogen. But it's still, for women, we want them over 50. Preferably over 60. So now triglycerides again is another kind of fat in your blood, and so we want that less than 150. And you usually see triglycerides go up with several you know, different conditions. A big one is with diabetes. You'll see someone with, you know, really horrible triglycerides. Now, here's some common misconceptions I want to just bring to your attention. Using margarine instead of butter will help lower cholesterol. That is a myth, okay? Thin people don't have to worry about high cholesterol. Yes, they do. Have you ever seen that commercial for Lipitor where you see this very fit-looking man on a diving board getting ready to dive, and he's jumping up and down, and then you see kind of like typed across the screen, gender, male, height, 5'11", weight, 165, you know, cholesterol, 300 and blah, blah. You know, yes, thin people can have issues with cholesterol, and it can be their food choices. I have people who I work with on the program that are thin, that have high cholesterol, that we've been able to take and control their cholesterol through changing their eating habits. So just like I tell people all the time, just because someone is thin does not mean that they're healthy. Okay? If a label lists no cholesterol, it's heart healthy. No, 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 no. Just because it has no cholesterol doesn't mean that it doesn't have saturated fat in there or other things that it should, you know, that would be good for you. So no, that is a misconception. Women don't need to worry about cholesterol. Yes, they do. Okay? So, I mean, people heard about this along, you know, for a while, because, excuse me, most of the main studies that were done, you know, for heart attack and cholesterol and strokes and stuff, these studies were done, but they utilized men. They never really utilized women in their studies. So that's, you know, where that misnomer came from. So only middle-aged people should have their cholesterol checked. Again, that's not true. Younger and younger people are having issues with high cholesterol. In fact, I'm going to show you an article in a little bit about that and the sickening thing that's happening in our society. So, I like this cartoon. An aspirin a day will help prevent a heart attack if you have it for lunch instead of a cheeseburger. Okay, so true. Now, what affects cholesterol? Okay, diet. Okay, plays a huge role. Poly and monounsaturated fats can help lower cholesterol when it's used in place of saturated fats, but you still need to limit it. And if a person is on a 5-in-1 plan, it is limited, you know. Now, high carbs, excessive alcohol can increase the triglycerides. And so, again, if someone's on our 5-in-1 plan, they're not getting high carbs, and they shouldn't be getting any alcohol. So that is something that's taken care of by our program. But once we take and transition people off, yes, of course they can have, you know, alcohol in moderation. I mean, Dr. A even says it's okay to have a glass of wine or one drink. Okay, soluble fiber can help lower the LDL, which is your bad cholesterol, but it won't do anything to the good cholesterol. It doesn't raise it, it doesn't lower it. Okay, weight plays a big role. Physical activity plays a big role. Age plays a role, and your gender plays a role, and also your heredity. So let me tell you something. The effects of cholesterol. There's things that are you know, your risk factors, okay? These are risk factors. There's things that are modifiable, and there's things that are not. You can modify your diet, you can modify your weight, you can modify your physical activity. Those are things that you have control of, okay? You can't control your age or your sex or what your genes are, okay? But the things that you can change can make a big difference. So I like this cartoon as well. If you look at this newspaper, it says, scientists discover fat gene. And then you see this big gentleman sitting there thinking, oh, that stinking fat gene. But look what he is eating, okay? Now, why does it matter? Why does cholesterol matter? Well, coronary heart disease is caused by atherosclerosis, which is a hardening of the plaque in the arteries, okay? And it's the single leading cause of death. So the higher the LDL, which is the bad cholesterol, the higher you have, plus the risk factors, increases the risk for heart attack and stroke. So if you smoke, if you have high blood pressure, if you have low HDL, family history of early heart disease and age, you're at a higher risk, okay? Again, there's factors that you can modify. You can modify your smoking. You can modify your low HDL, and you can modify your blood pressure, you know, in the ways I've talked about. You know, quit smoking. Control your sodium intake. Exercise more will get your HDLs up, and also taking that omega-3 fatty acids. So that's stuff that can, you know, help you. Now this article is just this saddens me. It just, when I saw it in the newspaper, I was just flabbergasted. In January of 2008, this article came out in the papers, and instead of counseling weight loss, exercise, lifestyle changes, they want to start little ones on some of the same statin drugs they use for adults, which have some really ugly side effects, okay? It just is sad. I mean, 8-year-olds being given cholesterol medication, it's just sad. So, some pearls for you, okay? Remind your clients to stay in touch with their doctors and to get lab work when it's recommended, because if they're on a statin drug or the cholesterol medications, it might need to be adjusted. Me, myself, before I started the program, my cholesterol level was 313. And they wanted to put me on medication, and I said, no, let's just wait and see a little bit. And so I went on the program, and in 6 weeks we redrew my blood work. and my cholesterol level went down to 170, and that was without medication. So definitely there'll be changes in the cholesterol levels in the lab work. Educate your clients on healthy fat choices and instruct them on the benefits of movement therapy. And I call it movement therapy because a lot of people just, as I said, have bad feelings about the word exercise. It's got this negative connotation sometimes. And some of the medications that you might see are Lipitor, Crestor, Zocor, Vytorin, Zetia, and you're looking, if it says like simvastatin or atorvastatin, anything statin usually is a cholesterol medication. But there's other medications out there that don't have statin, but they are cholesterol medications. I want to thank you all for being here on this call or this webinar. If you have any questions or need the handout, please don't hesitate to call me. My phone number and email is here. And I am going to open this up for some questions and answers. And but I'm going to stop the recording. So here we go.